What about when you have somebody who has come in who has a history of medical trauma? What does that look like for you? I know that brings in an extra kind of layer of history that can be challenging for certainly for the patient and possibly for you as you navigate supporting them.
Yes. Yeah. So I have some of my patients, of course, I always want to protect my patient's identity, even in, conversations like this. I have a patient who had a very long hospitalization as a child for not cancer, but for an unrelated reason, who was in a children's hospital for almost 2 years. And this was decades ago, and now diagnosed with an advanced cancer. And from the moment that we met, he had all sorts of uncertainties about if he would want any treatment at all because of
Yeah.
the things that he had faced. And we met a number of times before he made a decision. The first time we met, it was almost as if this couldn't be happening. Like, it was very surreal, and he didn't feel comfortable making any decisions in that moment. And he made very particular decisions, trying to avoid a port, which is a catheter under the skin, choosing some chemotherapy over others. And we've kind of walked through this as gently as we possibly can. That has been my approach, is to try to meet patients where they are, to invite them to tell me about those experiences if they feel comfortable, but not to push that if they don't feel comfortable. And then sharing what our options might be in as kind and gentle a way as possible, and then trying to sort through those decisions together. I also
Yeah.
have patients who develop medical trauma as they're going through cancer treatment. So I had a patient who, even as they were cleaning her skin to access her port, the smell alone, right? It was almost, sometimes she would just be like, I have to leave. And so she would just leave the facility. It was just too overwhelming. And so she came to me from a different oncologist, and she didn't always, I was very with her. She could get chemo when she wanted to, but it wasn't like, sometimes clinicians feel like, oh, if they're not adhering to this exact schedule or this exact structure and whatnot, then they feel as if they can't be treated there. Or, I have found that just trying to meet patients where they are and to recognize that there are a number of factors going on, helping ensure that as much as possible they have support. They have we have all sorts of layers of extra support in my clinic. My social work team, I have a psychologist, I have a psychiatrist, I have a dietitian, I have, a pharmacist. I have all these people that help support patients alongside me, which is wonderful. And a chaplain, they all bring additional skills. And I've found that that's been really helpful as well, to reach out to my other team members for support, but ultimately to try to, as much as I can, to meet that person where they are and to discuss what might be the best possible path forward, and then to make that decision together.